All right, we'll go ahead and get started here. Hello and welcome to our Network Health COVID-19 Vaccine Facebook Live here today, Wednesday, April 21st. I'm joined by Andy Wheaton, our Manager of Pharmacy Benefits, and he is our expert here at Network Health to talk about all of the updates on the COVID-19 vaccines in the state of Wisconsin. Just a quick housekeeping note before I pass it over to Andy. We do have Kelly in the comments here. She'll be sharing any relevant links or information that we mentioned here in the stream. And then if you do have any questions at all during the live, feel free to drop them in the comments and we will address them at the end. So Andy, can you tell us a little bit about yourself and why you are our COVID-19 vaccine expert?
Thanks, Chelsea. Yeah, so I'm a pharmacist and the pharmacy manager here at Network Health. This past fall, I co-led our Medicare flu shot events that were COVID friendly. And now I'm here providing some updates on the COVID vaccines and hoping to get everybody the most up-to-date information so you can make an informed decision on getting the vaccine.
Fantastic. So thank you. We will go ahead and jump right into it. So can you tell us a little bit, for those who may not know, just about current eligibility and where and how you can get a COVID-19 vaccine right now?
Yeah, so in the state of Wisconsin, we opened it up to anybody that's 16 years of age or older. So previously to that, you had to have some comorbid condition or some other situation where you were eligible, and that has all been removed. So anybody that's 16 years of age or older can now get the vaccine, which is extremely exciting. For those people that are still looking to get the vaccine, I would encourage you to look at our Network Health website. We have an interactive map that links up to the Wisconsin DHS website. This is updated on a regular basis, so we know which clinics and which pharmacies have vaccine available and are providing vaccines for that upcoming week. Most vaccination locations will open up their availability over the weekend, is what I'm seeing. So keep looking back. If you don't see something available at the pharmacy or the clinic that you're looking at, keep checking back, because those will open up based on their supply. I'm also hearing more and more about walk-in appointments, which is extremely exciting. This is something we've been hoping for, which means supply is available, which is very good for our state. So up in the Fox Valley area, the Oshkosh Sunnyview location, they had walk-in appointments, so keep an eye out for that. Down in Milwaukee, the Wisconsin Center is also providing that service. So we have a number of locations that are available. Keep checking back and make those appointments for those vaccines.
Wonderful. And that kind of, just to piggyback off of that, what is vaccine availability like? So it sounds like pretty good if we've got these walk-in clinics, but how does Wisconsin kind of stacking up in the number of vaccines we have?
Yeah, so there was I would say there was a small concern with the J&J vaccine being just on pause, so providers weren't able to administer those vaccines. We'll get to a little bit more of that information in the near future here, but from what I'm hearing throughout the state, the Moderna and the Pfizer vaccines are readily available. So pharmacies, clinics are able to provide those vaccines. So I don't have a concern with that at all at this point.
Wonderful. That's great to hear. And then just while we're kind of around the topic, can you tell us a little bit more, any updates on the J&J vaccine? I know last week it was recommended that it's paused and they're looking into it, but can you kind of give us the details on what this means?
Yeah, so just a recap of what happened last week. So on April 13th, the FDA and the CDC issued some recommendations to pause anybody providing the J&J vaccines. This was due to an ultra-rare blood clotting disorder that occurred in 6 women at this point that we're hearing about, out of the 6.8 million doses that have been provided so far. So out of an abundance of caution, they said, let's pause it, let's take a look at what's actually going on and either make some updated recommendations or maybe create some restrictions based on who can receive this particular vaccine. That was, they were supposed to meet, and they did meet last Wednesday. They asked for some additional information, and we'll make a decision this Friday. I really believe that the main issue here is getting the word out so healthcare providers know how to handle this situation if they come in contact with it. So it can't be treated like a normal blood clot. It has to be treated a little bit differently. So they want to get some of those restrictions or recommendations in place so everybody's aware. I really see that this is going to go back into circulation, which is a great thing. This is a very, very rare condition that occurs in a very, very small population. The vaccine is highly effective and it works really well. The one shot is a great opportunity. So we'll know more this Friday, and I'll provide the further updates later on next week.
Fantastic. Yes, we look forward to hearing those updates and what we find out. Can you tell us a little bit more just in general about the vaccine effectiveness? How effective is this at protecting you against COVID?
Yeah, so we've heard the numbers that have gone about with the effectiveness when they first got approved by the FDA. These are very highly effective against COVID, and especially against severe disease, which we look at as hospitalizations and even death. So all three of the vaccines, including J&J, the Moderna, and Pfizer, are all highly effective against that. Earlier this month, we saw that Pfizer provided some data saying that their vaccine is highly effective at least 6 months after the dose, which is good because we don't know how durable the vaccine is, the longevity of that. The reason why it's 6 months, that's just all the data we have. We expect that to be even longer, but at this point, that's where we're at. They also provided information that it's effective against the variants that are in circulation, which is one of the concerns that scientists throughout the world, quite honestly, are concerned about. So that's good news as well. So again, they're all highly proven to be effective against those serious disease and hospitalization and death. So we just want to make sure that everybody's aware of that.
Good to know. Fantastic. And we'll have more information as well, and links to that kind of information on our website, which I know Kelly will go ahead and drop in the comments below as well. Can you give us a little bit of an update on where we are with current case numbers and kind of the variants and what we're seeing with current infection rates?
Yeah. So in the state of Wisconsin, we saw a small spike over the past, I would say, 3 to 4 weeks, which was something that we were kind of monitoring with nicer weather coming to the state of Wisconsin. We were all coming off of winter. Everybody was looking to get outside and start hanging out together, right? We also saw some people going on spring break. So we saw that spike, people in general kind of relaxing those precautions on COVID restrictions. And that's one of the big reasons we saw that. As we get more people vaccinated, which we continue to do that at a great rate throughout the state, we're seeing the positivity rate go down. So we're now at a 3.5% trend in all cases throughout the state. So that's good news. We're trending in the right direction.
Wonderful. That's great to hear.
Yeah.
So another question that we have, we have a little lighting there.
I have an automatic light that shuts off on me, so I apologize for going dark for a moment.
All good. The realities of being on Facebook Live, right? Yeah. So another question that I think we've kind of seen, and I think is probably on a lot of people's minds, still working from home or as the vaccine is available to everyone 16 and up, is will employers require employees to get the vaccine, and kind of where is that line with employers and employees and having people get the vaccine?
Yeah, this is a question that we're getting quite often, and it's quite complicated actually. I must say that I'm not an attorney or a lawyer, so the legal implications I don't have that information. But from what I'm hearing is most employers are not requiring the vaccine for employees, but they're strongly encouraging it. And that's something we're doing here at Network Health as well. Some employers are even encouraging the vaccine by maybe a cash amount. So I just read, some of the grocery stores are encouraging their employees to get this by offering some sort of little bonus, maybe $50 or something like that, or providing a day off after the vaccination. So from a recovery standpoint, if there's any concerns there, they have some time off to do so. This is going to be a decision based on the organization. Each organization is going to have to make this decision on their own, but as we try to bring employees back into the office. But in general, from what I'm hearing and seeing, is most employers are going to just encourage the vaccination, but not mandate it.
Mm-hmm. Fantastic. And I think getting the vaccines to begin with are a pretty big factor to getting us back in the office for us who are ready to get back into the office. Let's see here. Another question. So another question that we have is, how do I convince or how do I talk to a friend or loved one about getting the vaccine? And how do I kind of have that conversation if someone is unsure about getting the vaccine?
Sure. Yeah, I mean, this is something I come across with family and friends myself, and I think the big thing I would do is focus on the facts. There's a lot of misinformation out there on on social media, throughout the internet, and word to word. If you're meeting with a neighbor across the street, or everybody has their own opinions on this, but let's focus on the facts regarding the vaccine. Make sure people have the correct information so that they can really make an informed decision. I want to make sure that everybody's aware you cannot get coronavirus from the vaccine. There's no government tracking device within the vaccines. Those are a couple of the common ones that we hear about, but I want to make sure and reassure everybody that those are not the case. Remember that getting vaccinated not only helps you and protects you, but also some of your loved ones and people that you're around that may not be able to get vaccinated or at a higher risk. So just want to make sure that you take that into consideration as you make your decision as well. Please reach out. We're open if you ever have questions. I'm more than happy to talk one-on-one if anybody has a question or concern about it, and we can go through some of those facts and make sure you're comfortable with your decision.
Absolutely, thank you. So I did get a question from a private message here, so we'll keep it anonymous for right now. But the question is, my parents who are 65 or older are resistant to getting the vaccine. They're worried that because it's so new, it's not really a vaccine and that it's not FDA approved yet, and that you can still spread it. Do you have any advice or resources to help them see the other side, or to kind of just speak to some of those concerns?
Yeah, I mean, I would look at how the FDA reviewed the information from the studies. So the vaccine studies were done basically overlapping one another. So a lot of people are concerned that it was approved in a very short period of time, and there were corners that were cut. That's not the case. The vaccine, in general, most vaccine clinical trials will kind of go end to end. Where this particular trial, they actually overlapped a little bit. So they didn't cut any corners. They just sped up the time frame by overlapping. They also started mass producing vaccine prior to being approved, which we've never had that before. So so that's why we saw it come into circulation a little bit faster than anything before this. So I would focus on that. Again, focus on the reduction in severe disease. I mean, if you compare this to the flu shot and the flu in circulation from years past, this is a higher incidence of actually having severe disease, so hospitalization and unfortunately death. So the chances are higher for that, for those people that have coronavirus. This is one way that we can protect ourselves, along with the COVID precautions that we've all been doing over the past year plus at this point.
Fantastic, thank you. That was very helpful. So I'm not seeing any questions. If we do have anyone who's watching who has any questions, feel free to drop them into the comment section here. Or again, feel free to send us a message. As Andy mentioned, we're happy to kind of take things offline and chat one-on-one if you do have specific questions that maybe you don't want to kind of address here. We're happy to connect with you and help you understand more about this vaccine, because it's new for a lot of us. So getting the facts and knowing the information is incredibly important. So I don't see any questions. I think we'll go ahead and kind of wrap it here. Andy, do you have any parting thoughts before we close it for this week?
No, just make sure you keep checking back. There's a lot of appointments available throughout our service area in the state of Wisconsin. We've continued to do an amazing job at getting COVID vaccines out into the public's arms. So make sure that you're checking back if you're still one of those members that need a vaccine. There's lots of opportunities out there. And again, please use us if you have any questions about it and you have any hesitation that you need some confirmation about some of the facts, please reach out to us. More than happy to meet with you one-on-one if that's the case.
Absolutely. Fantastic. Thank you so much. And we will be back next week for the latest COVID vaccine updates in Wisconsin. Thanks. Bye-bye.
Thank you.